everyone to the new year of Brain and Mind, a series of events that we've now been running at St. Hilda's for, if you could believe it, I can believe it, 11 years now. And we're delighted to see so many of you, especially from schools around the area. Can I just ask, are there any A-level students or even GCSE level students? Oh my goodness, that's fantastic, wonderful. Special welcome to you. Of course, a special welcome to everybody, but it's the younger, really younger generation that we hope to involve in our activities. So, Brain and Mind meets once a term in each of the Oxford terms. And each year we choose an overarching theme and then zoom in each term to some subsection of that theme. Now this year, the overarching theme is mental and physical health. And tonight we're discussing anxiety. In Hilary, that's winter term. We'll discuss bodily disorders, including anorexia. And in Trinity, or spring term, we'll be discussing movement, sport, and the brain. Now, the dates for these events are all on the back of your program, or on the back page of your program. And the program includes information about our event tonight, so hold on to it. It also includes some reading that each of the speakers have kindly offered, so that if any of you want to carry on thinking about these topics after our event, feel free to do so. Actually, also, if you want to hear this event again, if you look online under the JGP Brain and Mind, you'll see all our past events are online on YouTube, and you can see any of them. About 33 topics over the last 11 years. Now, I should also explain that these events are held in collaboration with a medical school in Hamburg, and although we usually have them and that audience on the big screen, tonight they were having an IT issue, so they're just following us on Zoom, and they will be, maybe, if they have questions, providing them through the chat, and we'll be looking at their questions and taking those questions as well, just so you know we've got another audience somewhere else in Europe. Now, this event is funded by St. Hilda's College, and their funding covers tea and cake at the halftime break, and I hope you'll enjoy that. We usually get some very nice cakes. It also covers dinner for the speakers and their travel expenses, and in case you didn't realize this, our speakers get no further remuneration, just their dinner tonight. And although we have funding, it's not very generous. It's a bit limited. So as things stand, we're now, in the last few years, only able to offer, occasionally we can get somebody up from London, but most of our speakers have to come from within Oxford. And it can be a little limiting, because sometimes the expert and topic is outside of Oxford. So we're inviting people, if possible, to give donations, and we have that barcode on the program, and also when you go to get your ticket on Eventbrite. And I know when people ask for that, I always think, oh, is it really worth it? How much should I give? £5 would be great. £10 would be great. A little more if you can, that's fine. But every little bit really would help. It would mean we could get that extra speaker in. So I just put that out in case anybody feels generous tonight. Now, as many of you who are regulars will know, these events are designed to bring together an eminent researcher from the three disciplines, neuroscience, psychology, and philosophy, to speak about a topic that's of interest to each of them. We don't ask the speakers to confer beforehand or to try to make their talks coincide. Rather, we simply choose our speakers as their experts on the topic, and then ask them to talk about it, to tell us how their discipline approaches that topic. Now, what's so utterly fascinating, especially I hope for the younger scholars, is just how different these approaches are from each other. And yet, each seems to be researching the same topics. Sometimes they come together in a lovely way, but it's our experience over these 11 years that the time we spend together each evening, each of these evenings in discussion, is fascinating and fruitful. So now our topic for this evening is anxiety. You'll notice that tonight's program has a rather beautiful image on the front cover. And some of you may notice that it's a painting by Georgia O'Keeffe. And the image was chosen for the program by our new student member of the committee, of the Brain and Mind Committee, Georgina Summers. Georgina, stand up and just so people can say. and we welcome you onto the committee. The other members of the committee are Anne Dowker, our psychology lecturer here at St. Hilda's. Anne.
Hi.
And myself, I'm the philosopher. And then we have Micah Glitch, who would be up there on the big screen saying hello to you too, but she's in Hamburg. And she represents the neuroscience. She was our clinical medicines fellow here at St. Hilda's for many years before she moved to Hamburg. Now, Georgina is replacing our student on the committee for the past 5 years, and some of you who've been attending will remember him, Barnaby Burley. And I'm pleased to say that Barnaby, he's now Dr. Burley as of August, is now a postdoctoral fellow at the University of Chicago Society of Fellows in the Liberal Arts. So we wish him well, and he did serve us well for so many years. And Georgina has now taken Barnaby's place. Now, when I asked Georgina to come up with an image for the program tonight, she came up with the O'Keeffe image. And while I recognized the image, I was perplexed as to why she chose it. Her reply is printed on the program just below the image, and I encourage you to read it. In her email to me explaining about the image, she wrote that O'Keeffe used her paintings to help her mediate her own anxiety throughout her lifetime, and that she used to paint every flower 3 or 4 times, getting more abstract as a manifestation of high-functioning anxiety. I found that utterly fascinating, and thank Georgina for her initiative in finding that for us. Anxiety is something all of us will have experienced in our lives, some perhaps more than others. But it is, one might say, a condition of the human life. But what precisely are we talking about when we say we're anxious? Is there some specific thing we're anxious about? Or is one's anxiety a somewhat general feeling, a mood that pervades the way we experience the world? How is anxiety related to fear? And is anxiety something to be avoided? Indeed, would we be better off if we never experienced anxiety? To help us answer these questions, I'm going to turn to our first speaker this evening, who is Professor Oliver Robinson. Professor Robinson did his PhD in psychiatry at the University of Cambridge, went on to do his postdoctoral training at the National Institute of Health in Bethesda, Maryland, in the United States, and he's currently Professor of Neuroscience and Mental Health at the University College London. And the title of his talk this evening is The Overlapping Neurobiology of Adaptive and Maladaptive Anxiety. Oliver, over to you.
Thank you so much for the invitation. It's an honour to be part of a series that's been going on for so long. And also, congratulations for going on for 11 years. That's fantastic. So, yes, I'm doing the neuroscience part of today. And getting straight into it, anxiety is clearly a disorder, right? It's a maladaptive state. We can diagnose it using, for example, manuals, checklists. This is the diagnostic criteria in the DSM, the Diagnostic Statistical Manual. It basically says you need to have at least 3 of these symptoms, so half of these symptoms, for more days than not over the last 6 months. And these symptoms are things like irritability, muscle tension, sleep disturbance, difficulty concentrating, being easily fatigued, or restlessness. Of course, if it's only 3 symptoms, 2 people could meet the diagnostic criteria, only, they're not overlapping at all in their symptoms. But this would be how we diagnose a disorder. These disorders are extremely common. In fact, they are the most common mental health problem. This is data from the UK's psychological treatment services. We've got really good data for all the people who come in for therapy, as it were. And you can see that the largest bar, by far, is people being treated for what's called anxiety and stress-related disorders. These disorders are very debilitating, but at the same time, anxiety is also clearly a normal adaptive function. Every single one of us gets anxious, okay? And I think it's quite unique from a mental health perspective to have this kind of clear adaptive function. It's not true for many other things. It's not true necessarily for psychosis or for bipolar disorder, things like that. But anxiety is definitely a disorder, but it's also an adaptive function. So, for example, if I was to drop you in this dark forest here, you would feel anxious, right? Why would you feel anxious? Well, you can't quite tell what's going to happen. You've not been there before. Perhaps in this darkness here, there might be a wolf, a murderer. Like, you just don't know what's lurking. So what your body does and what you feel is a kind of heightened sense of trying to detect harm. Your pulse starts racing. You might start breathing a little faster, or even maybe a little bit slower, so you can hear things. But critically, you're getting ready to do whatever it might be that you need to escape harm, but you don't know what that harm is. Now, an interesting question, therefore, that perhaps we can use neuroscience to at least partially answer, is to what extent are these two states, the maladaptive anxiety disorders and the adaptive anxiety, are they essentially the same thing, right? Is essentially an anxiety disorder basically adaptive anxiety that's stuck in the on phase? Because normal anxiety, I take you out of that dark forest, you get home, you're sitting on your couch having a cup of tea, watching TV, slowly but surely that anxiety will dissipate. So anxiety turns on when you need it and it turns off when you don't. But in anxiety disorder, it's almost as if you're stuck feeling anxious even at times that you don't need to. So you feel this existential feelings of dread even though you're at home and you're completely safe and there's no risk. So to what extent is the underlying biology basically the same? So that's what I'm going to talk for the lion's share of this presentation about. So I'll start with some more specific definitions of anxiety and how it differs from fear, which we've already alluded to in the introduction. I'm going to then say how, using these definitions, we can now elicit anxiety in the lab experimentally using electrical shocks. I'm then going to talk about how, using this technique and then comparing it to anxiety disorders, we can look at what's going on in the brain and try to start to answer the question, to what extent do these two states look like each other in the brain? And then in the final section, I'm going to sort of briefly touch on, hopefully not going to rush through it too much, but this is called the Brain and Mind series, so I'm going to try and touch on what I think the mind might be doing, and that is the computations that this brain activity might be representing. Okay, so anxiety versus fear. Like, we often use them colloquially kind of to mean the same thing, but I'll give you some definitions where I'll use them they'll have specific meanings. So fear, right? Let's say you don't like spiders, and I'm sure there are some people in this room that don't like spiders, which is why I've used this silly cartoon image of a spider. Right? Say you don't like spiders, and I put a spider in front of you. It's there, right? You're not going to be happy with me, but it's there. When I take it away, it's not there anymore. Okay? That is a knowable, seeable, certain thing. It's predictable. That is a fear response. Okay? If the bad thing is knowable and it can go away, then it's predictable. That's fear. Right? On the other hand, say you still don't like spiders, and I take you and I put you in this cave, right? And I say, oh, by the way, there's probably some spiders in there, okay? You can't see the spiders, right? But the fact that you can't see them doesn't mean that it's fine, right? In fact, if anything, it's worse, right? The fact that the spider could be anywhere, it could be about to drop on your head, that makes you feel a lot more, that in many ways is a worse feeling. That feeling, that unpredictable feeling of the bad thing, that is anxiety. So fear is the response to a predictable, knowable, certain thing. Anxiety is the response to a bad thing that is unpredictable, uncertain, unclear. Okay? In one case, it's very clear and constrained. In the other case, it's very diffuse and fuzzy. So these are the adaptive terms. We also have disorders that meet these criteria. So a maladaptive fear response would be a phobia, and a maladaptive anxiety response would be something like generalized anxiety disorder that I introduced you to the diagnostic criteria for at the beginning. Okay, so using these definitions, we can now start to elicit feelings of fear or anxiety in the lab. So we do this, if you can believe it, regularly every day to people who come to our lab who get electrical shocks from us, okay? So we'll wire your wrist or your ankle up to electrodes, and we'll turn it up, get it to a point where you say, I don't like that, okay? Now, it kind of feels, it's not really, really painful. It feels a little bit like as if you have an elastic band and you let it snap against your skin. Not great, but not unbearable. So fear, predictable response. So we can set this up in the lab. So I'm going to show you, imagine you're looking at a screen and you see these orange squares. This arrow is showing you time. Imagine that square is just flashing in front of you. On, off, okay? What I'm going to do is 50% of the time, whenever you see that square, you're going to get an electrical shock, okay? What happens over time is that square will take on the properties of a shock. This is Pavlovian conditioning, right? This is that the previously neutral stimulus starts to take on the properties of the electrical shock. Whenever you see the square, you're worried you're going to get an electrical shock. So now we've fear conditioned you to this square. Now, what about anxiety? Well, we can take the exact same paradigm, but now I can give you shocks when in this case it's a pink triangle, I'll give you shocks when the pink triangle's on the screen, but I might also shock you in the gap between the triangles, right? So whilst the orange square, you can be like, the square's not on the screen, square's on the screen, square's not on the screen, right? With the purple triangle, any time there's a hint of a purple triangle, you could get a shock at any time, right? That's going to make you, in the case of the fear, you're going to be prepared only when the square is on the screen. In the case of the triangle, you're going to be feeling anxious the entire time. So we can also have a condition where, let's say, we have green circles, and we're not going to give you electrical shocks at all. And over time, you just learn that these are totally safe. So what we can now do is we can compare these two conditions, right? This is the anxiety condition, the unpredictable shock condition, and this is the safe condition. And so this work came out of a lot of psychophysiological work where people were looking at things like skin conductance and startle responses and so forth. During my postdoc, we basically took this paradigm and we started applying it to everything. So we have people do all sorts of tasks, have them do computer games, whatever, whilst half the time they're at risk of getting electrical shock and the other half the time they're completely safe. So what this means is that in the lab, you can bring someone in, you can have them do whatever it is you want them to do, but you can tell them risk of shock, safe from shock, risk of shock, safe from shock. What that means, I could put you in a brain scanner and look to see what's happening in your brain during the times that you are at risk of shock and the times that you're safe from shock. So I can now look at what's happening in your brain when you're getting, in this case, an adaptive anxiety response, right? It's totally adaptive and normal to feel anxious when I'm threatening you with electrical shocks. So what this means, and sort of cutting a long story short, is that I started doing this over 20 years ago now. There's quite a lot of work since that's been using this exact paradigm in healthy people, putting them in scanners, threatening them with electrical shocks, that we can start to do what's called a meta-analysis, which is where we look across all the studies that have ever been done, and we can look at, are there any patterns of brain activity that seem to be consistent across these thread of shock studies. And so this is what my old student, Alice Chavan, did a few years ago now. She searched the entire literature for all of the studies that involved threat of unpredictable shock, so having people do all sorts of different tasks in a scanner whilst they're at risk of shock and safe from shock, risk of shock, safe from shock. What that means is we can now look at what's going on in your brain during adaptive anxiety. And she was able to find studies that at that time comprised about 700 people undergoing this manipulation. So we can look at what's going on in their brains. We can also compare it to groups of people with anxiety disorders. So similar people being scanned, groups of people who meet criteria for an anxiety disorder versus healthy controls. So what we can now do is we can look at what's going on in the brains of people when they're being threatened with shocks, adaptive anxiety, what's going on in the brains of patients with anxiety disorder compared to healthy people. Okay, so let's cut straight to the chase. This is the brain activations that we see for adaptive anxiety. So you don't need to worry too much about what we're seeing here, but we have this big blob along the medial wall. This is basically a slice through the middle of the brain. This big blob here is medial prefrontal cortex and cingulate, and this is basically in red, means it's more active when you're at risk of getting electrical shock, more active when you're anxious. And we have a whole variety of other brain regions. These bilateral regions here are called the insula. There's a very small region that's buried down here called the periaqueductal gray, the PAG. Another small region called the bed nucleus of stria terminalis that's buried down here. But critically, for those of you who might have done A-level psychology, for example, we don't see this region called the amygdala, which we think of conventionally as being important in fear and anxiety. When you take healthy people and you threaten them with electrical shock, you don't reliably see an increase in activity in the amygdala. What about anxiety disorders? So now we're looking at people who have an anxiety disorder compared to healthy controls. And we can see actually a lot of this, if you squint, you might see sort of similar patterns of activity here. We've got this blob on the medial wall here. This is your cingulate medial prefrontal cortex. We've got this bilateral insular activation. We've again got periaqueductal gray down here. We don't see this region called the bed nucleus of stria terminalis, but we do now see bilateral activity here in the amygdala, right? So you can kind of compare across these two maps. If you squint, you can see they're kind of similar. Well, we can actually do that mathematically. This is essentially the conjunction across these two maps. These are regions that are consistent across induced anxiety, adaptive anxiety, and pathological anxiety. And what you can see, lo and behold, makes sense. We get this bilateral cingulate region, we get the insula on either side here, with the periaqueductal gray, but we don't see these two smaller regions, the amygdala and the bed nucleus stria terminalis, because they seem to be specific to one or other state. The amygdala seems to be specific to pathological anxiety disorders, and this bed nucleus stria terminalis region seems to be specific to induced anxiety. So going back to the question I asked briefly at the beginning, to what extent is pathological anxiety just adaptive anxiety that's stuck in the on phase? And the answer is kinda. Quite a lot of the brain regions that we're seeing here are overlapping. 80%, maybe 9% of the brain circuitry is exactly the same, but there are some specific regions, the amygdala being one of them, the vagus terminus being the other, that are selective for these two conditions. So why that is, we don't really know, but it does look a lot like adaptive and pathological anxiety ultimately share the same circuitry. So, just in the final part of this talk, what is this neurobiology doing? Why do we see these patterns of activity? So what we know in anxiety is that it's priming you to detect harm, to detect threats. So if you're processing information, the scales of information processing are biased towards threat when you are anxious. So what might this activity be representing? What might be biasing you towards threat? So since this is brain and mind, this is perhaps what the mind is doing. The other half of my lab does something called computational psychiatry, which is trying to build and understand the computations that the brain might be doing. So one of the key things we focus on is something called reinforcement learning. Reinforcement learning basically just describes the process by which you get rewards and punishments from the environment and then learn. Okay? So let's say you're playing a simple video game, you move the paddle, you bounce the ball, you get points. If you miss it, you lose a life, you lose points. Over time, you get better and better and better at performing this game. Now, it turns out that we can write down, and I'm not going to go into any detail about these, but we can write down the maths that describes this learning curve. The relationship between rewards, between actions and outcomes is described by these, it describes this curve. Now, it turns out we're so good at doing this that a lot of the advances in AI that we've seen explode in the last few years basically have this kind of reinforcement learning underneath it. It turns out that basically you can generate human-like behavior using this maths, this reinforcement learning algorithm. So, as I said, people who are anxious show a bias towards threats. Now, we know that patients and, so you have a cognitive task, a control group and a patient group perform differently. If we can use these underlying algorithms to make human-like performance on cognitive tasks, we can ask the question, what do we need to mess with within these algorithms? What parameters within these algorithms do we need to change in order to make them behave more like someone with anxiety? Now, this is really a whistle-stop tour, but there are two parameters in these models that I want to mention today. We're interested in how you might be biased towards threats, how you might be biased towards bad things. Now, one set of parameters is something called sensitivity. Sensitivity is like how loud things are, so how loud bad things are to you, right? If something is really bad, let's say, for example, you don't like spiders and you have spider phobia, that means you have a high sensitivity to spiders to someone like myself who is not bothered by spiders. Okay, the same stimulus, one of us is much more sensitive to it. Or for example, if you're a millionaire and I give you £5, you're going to be much less sensitive to that than if you have no money and I give you £5. Same stimulus, different volume. So that's one type of parameter, and we can split that into things for rewards like money or punishments like spiders. Now another type of parameter is something called learning rate. This can also change how sensitive you are to good or bad information from the environment. A learning rate, which again can be split into rewards and punishments, basically describes how quickly you change your behavior in response to a bad outcome. So for example, a common problem, for example, for anxious patients is they hear about, let's say, a plane crash and they're due to fly the next day and they say, I'm not flying, right? I've immediately acquired the information, hearing about the plane crash, flying is too dangerous, I'm not going to fly, right? On the other hand, let's say I don't have a fear of flying at this moment, but let's say I hear about a plane crash tomorrow, and then the day after, and then the day after, and then the day after, and the day. At some point, I'm going to go, what's going on with flying, right? At some point, I'm not going to take the next flight. I will have a lower learning rate, but at some point, I will learn that flying is dangerous, okay? So learning rate basically just describes how quickly you change your environment, you change your behavior in response to changes in the environment. So cutting a very long story very short, we did another meta-analysis of all the studies in the literature that are looking at these kinds of tasks that involve reinforcements, but also using reinforcement learning models to ask whether are there any clear patterns in the differences between people with anxiety disorders and healthy controls in terms of these two parameters that I've just taken you through on reinforcement learning tasks. So I'm going to show you two quick plots. The key thing to note is that if the dot is going that way, that means that parameter is higher in controls. If the dot is going that way, that means it's higher in patients. So the first thing we're going to look at is learning rate. This is that one I just told you about, which is how quickly you change your behavior in response to bad things. We're going to look at learning rates for rewards. We're going to look at learning rates for punishments, okay? These are the two graphs. Zoom in on these dots that you probably can't see very well down there. But what you'll see is this dashed line here means no difference. right? So this dot is further to this side, it means it's higher in patients. That means the punishment learning rate across, in this case, I think about 20 or 30 studies, we can see that patients have a higher punishment learning rate. That is to say that patients are quicker to change their behavior when they hear about a bad thing. They take fewer plane crashes before they change their mind about flying. Controls, on the other hand, have a higher learning rate about rewards. They're much quicker to update their behavior when they hear about a good thing. They're much quicker to go to the restaurant that they've heard is really good than someone who is anxious. These are pretty small effect sizes, but they are there across all of the studies. And then just the other parameter I told you about, which is sensitivity, which is the volume, how much you dislike bad things. Well, actually there's no difference at all. These are sitting on these dashed lines. So what this means is that people who are anxious, it's not that they are afraid of bad things more, if that makes sense. Anxiety doesn't make you more sensitive to bad things in these studies. What it's showing you is that when you're anxious, you change your behavior just that little bit quicker when you hear about a bad thing, right? You learn a little bit faster about negative information in your environment and actually a little bit slower about rewarding information in your environment. So, the interesting thing about these models, which I don't have time to go into, is that they are biophysically plausible, i.e. the maths included in these models are things that the neurons within our brains could actually do. So, we have this pattern of activity that I just told you about in the first half of the talk, and we know that people who are anxious show these biases towards threats. Is what this brain activity representing these sorts of parameters that I just took you through here? Is this pattern that we see consistent across adaptive and pathological anxiety, does it represent elevated punishment learning rates in people with an anxiety disorder, or indeed a healthy individual being made to feel anxious? Now, we can't answer that question because we don't have enough data out there now that uses these kind of tasks, which are amenable to these models, and brain imaging. Because if we could then map these parameters back onto the brain, but we can't do that yet because we just don't have the data, but we will watch this space. So that's basically it in a sort of whistle-stop tour of what we do to try to understand the neuroscience of anxiety, both pathological and healthy anxiety. Thank you very much.
Okay, actually this has felt the most relaxed of any of the events we've done recently, and I don't know whether it's my psychological time or whether I should thank the speakers for being so prompt and not going over time, because it's left enough time for us to enjoy a cup of tea and to chat with each other. And now we're all ready for the last speaker of the evening, who is Professor Stephen Mulhall, Fellow and Tutor in Philosophy at New College here in Oxford. Now, when you hear his voice, some of you may recognize it because he's been a speaker on Melvyn Bragg's In Our Time program on Radio 4 several times, haven't you? Yeah, and he's author of a great many books which deal with the works of, amongst others, Ludwig Wittgenstein, Martin Heidegger, Soren Kierkegaard, and Stanley Cavell. And tonight, he's going to tell us what Heidegger has to say about anxiety and fear. Stephen.
Thanks for coming back, as opposed to drinking your tea and then running off. So, as Anita said, we all prepared our talks independently, but it did strike me sitting there listening to Oliver and Alex that there really is a lot of interesting comparison and contrast between the way Heidegger approaches this area and the way in which they both did. And it does have to do with this question about the normal and the pathological, and also about the relationship between what Oliver was calling anxiety and what he was calling fear. That was a contrast he was using at the beginning. I'm going to use the same contrast, but Heidegger uses it to a very different kind of end, although it's an end that I think does ultimately connect with the issues that both of the previous speakers were trying to bring out. So I want to start with the way Heidegger treats the notion of fear. And here, to some extent, I can even pick up the same examples that Oliver was using. So Heidegger thinks about fear the way he thinks about almost any mental state that human beings can find themselves in. He thinks about it as having what he calls an intentional structure, that it is object-directed. It's directed towards something or other. And this is a truth that he thinks is completely general about mental phenomena. If you think about the idea of a belief, it's always a belief that such and such is the case. If you think about a thought, it's a thought about a particular situation or something of that kind. But he thinks exactly the same thing about the structure of emotions, generally. And that means he would say the same thing about something like fear. It has an intentional structure, it has a direction. It's something that opens us out towards the world. And more specifically, he thinks about it as having a kind of tripartite structure. The aspect of fear that we most intuitively focus on is the sort of state we're in when we're afraid. And it has a lot of characteristic symptoms: sweating, adrenaline racing, a kind of inability to concentrate on other things, and so on. But in a sense, that's the least interesting part of it for Heidegger. He thinks that there are two other aspects to the structure of a state like fear. So in the first one that he focuses most attention on, fear is always fear about something. Yeah? Yeah. Okay. All right. So fear is always fear about something. So Oliver talked about the idea of a wolf. Right? That would be a classic intentional object of fear. Right? If you're afraid, someone can always ask you, what are you afraid of? And the answer to that question will give you the intentional object of fear. They can also ask you, why are you afraid? And there the question is, what is it of value about yourself or someone or something else that you think is threatened by the object of fear? So you have this kind of complicated structure underlying anything that Heidegger would recognize as an emotion, like fear. And one of the things that's striking about this is that it immediately brings up the idea that a fear response, like any other emotional response, is not just something that, as it were, is caused by an object or a situation in the world. The kind of relationship that you have with the world when you are afraid of something is the kind of thing that can be evaluated as appropriate or inappropriate to the object. So if you find yourself confronting a wolf 2 yards away from you in a great empty field, it's entirely appropriate for you to feel fear. And because it's fear of a wolf in that situation, it becomes fairly clear what the appropriate response is going to be, right? You move very, very fast in the opposite direction, or something along those lines. Yeah. But if you think about spiders, Oliver's offering that to you as an example of a kind of object of fear. But if you think about it in terms of whether or not the object merits the response, then you're going to get a very different answer than you would to the case of the wolf. Right? If the kind of spider you're confronting is a perfectly normal UK house spider, and your response to it is to scream and jump on a chair, then the object of your fear doesn't merit a fear response of those kinds. And that's what takes you into the domain of the abnormal or the pathological. Right? We might have a lot of sympathy for someone who is struck by that kind of fear of house spiders. We might have to try and accommodate it in various ways, but we wouldn't think that the fear was appropriate to the object. Yeah. So it's a crucial part of what Heidegger thinks about emotional states, that they have what you might call a cognitive dimension to them. They disclose the world as having a certain kind of significance to it. Right? And as a result of that, they disclose us as the kind of beings who always exist in these kinds of worldly situations and who are always confronted with the need to respond appropriately or inappropriately to the particular objects and situations that we encounter. Yeah. Now that's the kind of basic story about emotions Heidegger wants to tell. But one of the reasons he wants to tell it is that he thinks there's a particular emotional state that both resembles that but also importantly contrasts with it. And that's what he calls anxiety or angst. Yeah? And I think it's a question, a real question for this session, whether or not when Heidegger talks about angst or anxiety, he's talking about anything that's been discussed so far in today's session. I think there are important connections, but I think there's something particularly distinct about it. The way Heidegger puts the difference between something like fear and something like angst is that he says angst is objectless. Now, one way of trying to illustrate this that I use when I'm teaching undergraduates at Oxford is to think about their finals exams. Much of my time is spent with third-year students who will have their final exams at the end of that third year, And in the Oxford system, the whole of their degree classification pretty much is going to turn on how well they perform in those exams. So you get a lot of very anxious students in their final year. Now, there are two ways in which you can think about the stress or anxiety that they're undergoing. Right? One is to think about it as a kind of fear. In other words, it's directed to and responsive to a very particular kind of challenge or threat that they face. And when you think about it that way, you can teach them appropriate modes of response to it. Yeah? You can tell them, revise more efficiently, and here are some strategies for revising more efficiently. Make sure you get sleep. Make sure you get a proper diet. Make sure you break up your revision sessions with sports or something along those lines. And for many people, that massively assuages the fear and the stress that they feel. But underlying it all, it seems to me, in a lot of cases, is something that Heidegger would call angst rather than fear. Because what, as it were, my third-year undergraduates are, in many cases, responding to is not the specific difficulties posed by doing well in an examination. They wouldn't really have got to where they are without developing lots of skills and strategies for that. What they're really responding to is the fact that once they finish finals, that's it. The whole of the rest of their life begins. Right? For the last 3 or 4 years, they've been living a life structured by the institutional contexts in which they're living and working. When they finish those exams, none of that structure and context is going to be there anymore, and they're going to have to make some really big decisions about how to live their lives, what they're going to do with the rest of their lives. And they have a sudden realization that no one and nothing other than them is going to be ultimately responsible for how they address that challenge and which choices they make. And this is what Heidegger thinks is really significant philosophically, or you could say existentially, about what he calls angst. Right? What he says in his book, Being in Time, is that although there's a sense in which angst is objectless, there's also a sense in which angst is keyed to something that actually comes along with every specific object and situation that we encounter in our lives, and to which there might or might not be an appropriate response. So if you think about the finals exam, it's an object of fear in Heidegger's sense, and there are appropriate responses to it and inappropriate responses to it, taken that way. But what you're doing there is focusing on particular situations and particular objects that you encounter in them, and they could always be otherwise. But every time you encounter a particular object and respond to it, you're doing so as the kind of being who has an existence to lead in a world which throws up these kinds of objects and situations all the time. So regardless of which particular object or situation you're presently occupied with, it's a worldly object or situation. And it's an example, accordingly, of a structure that conditions the whole of your existence. Right? The way Heidegger thinks about it, the phrase he uses is, our mode of existence is thrown projection. Or the other way he describes it is by saying, our being, our mode of being or existence is being in the world. Right? And he thinks that those two phrases interact in a really interesting way. So when he says that the kind of existence we have is thrown, what he's referring to is the sense we have that the worldliness of our existence is not something we can control or for which we're responsible. Right? One thing that many people in this room might have said to their parents when they were teenagers is, I didn't choose to be born. Right? Nobody has control over their coming into existence. When you come into existence, you don't have any control over the fact that it's going to be a worldly existence. It's going to be an existence in which you try to lead your life in a context, an environment, which exists independently of you. And when you find yourself living this kind of worldly existence, you can't choose not to choose how to live it. Yeah? Ultimately, that responsibility is down to you. So when Heidegger talks about human existence as throne projection, what he means is there's always an aspect of it that is given to us, that isn't subject to our control, but within that we project, we actively engage with the world, and we try to realize certain goals and purposes and existential possibilities. So there's the thrownness and there's the projection. And what Heidegger wants us to see about angst is that it is being in the world that is the true object of angst. Right? What, as it were, makes us anxious, what seems challenging or threatening to us, is the very same thing that, as it were, threatens something that's valuable to us, our own existence, and the underlying structures and conditions of that existence. So when Heidegger thinks that when you're in a state of angst, it's your own being in the world, your own worldly existence, that is the object of your anxiety. Right? That's what your angst is directed at. But if you recall the fear structure that I was talking about, in the case of fear, what you're afraid of and what you're afraid about are two different things. Right? You're afraid of the wolf. Why? Because it might seriously damage your body. Right? But in the case of angst, you're afraid of leading a worldly existence, leading a distinctively human kind of existence, but that's the very thing that's under threat. Right? What you value and what's under threat are one and the same thing, namely the particular kind of existence that you live, like any other human being. And most fundamentally, what you're anxious about is the fact that you can't slough off the responsibility for that life onto any kind of external source or grounding or justification. Some people might want to do that by invoking God. Other people might do it by invoking a certain kind of animal nature that all human beings have. Maybe you could invoke the brain. But none of those answers would satisfy angst as Heidegger understands it. So what the experience of angst does is disclose something about the fundamental structures of your existence as a human being that are always there. You can't get away from them because they condition and determine your life as a distinctively human kind of life. And that means that they come along with all of the more object-specific mental states, whether they're cognitive or emotional, that make up the particular state of your life at any particular moment. No matter whether you're fearing the wolf, or anxious about the dark forest, or really happy about somebody's birthday party, or whatever it might be, at one level you can distinguish the two kinds of fear from the happiness, but all of those different specific emotional and cognitive states are worldly phenomena. It's only possible for you to experience them because you lead the kind of life that is worldly, that is being in the world, that is throne projection. So whenever you have something like fear, which is object-directed, you always have the possibility of angst coming along with it. Because any particular object-directed emotional state has to be a worldly state. It has to be one that occurs within a world, and it has to be one that involves you taking responsibility for a particular response to it. Yeah? That's why there's a sense in which angst, as Heidegger understands it, is completely different from particular object-directed phenomena like fear or adaptive anxiety, as Oliver called it, or maladaptive anxiety. Yeah. But there's a really tight connection between the two, because it's always going to be possible for your, as it were, your focus to slip from the particular object-directed situation you're in to the sheer fundamental anxiety-inducing fact that you're always in some situation or other, always obliged to take responsibility for how you respond to it, and that this responsibility never goes away until you cease to exist. So in that sense, angst is the kind of inevitable shadow of any object-directed emotional state. And on Heidegger's view, this is my final point, there's something almost, well, existentially or philosophically valuable about it. Because what it does is shift your attention from the particular state you're in, the particular situation you're confronting, and it makes you realize that there's always more to you than that particular state. The situation could be different. You could make different choices in relation to it. You have a responsibility that you can exercise, but you can't choose not to have that responsibility. And what Heidegger thinks that the experience of angst discloses to you is the fact that you have a life that is yours, that belongs to you, for which you are responsible. It's a life that you can either own or you can disown. You can take responsibility for it, or you can avoid responsibility for it. And Heidegger thinks that most of us, most of the time, are so preoccupied by the particular objects and the particular situations and the particular challenges that situation poses for us, that we forget that we actually have a fundamental, undeniable, unavoidable responsibility for our life as such. And he thinks that it's the beginning of ethical and existential understanding to realize that fact about ourselves and to confront it rather than to avoid it. I'll stop there.
Can I ask you, Stephen, to do one favor, because we have some very young people in the audience. Can you tell them when Heidegger wrote and a little bit about it?
He had a really long intellectual career, but he started in the 1920s, and the analysis I was just trying to summarize for you of the significance of angst and its contrasts with something like fear, that was in a book called Being in Time, which came out in 1926. And he then went on to develop all kinds of further philosophical thoughts for about another 50 years, I think. He died in the 1970s.
He was also a German philosopher, and was part of what's come to be known as the phenomenological school in philosophy, in case anybody knows about the different schools of philosophy.
Yeah, what I was describing as a kind of intentional approach to our mental life, that's one of the kind of characteristic approaches of phenomenology. And the idea of being in the world, as I was trying to explain it, is a kind of generalization of that idea. So we have a kind of intuitive idea that human subjects and material objects are two completely independent things, and we have to bring them together. We have to make an effort to get out from the subjective side to the objective side. And phenomenology in general, and Heidegger in particular, starts by making the opposite assumption. It starts on the assumption that we're always already engaged with what we think of as objects and situations outside ourselves. They're not really outside ourselves. They're kind of part of the internal structure of what it is to lead a distinctively human life.
So I just thought I'd give you that little bit of background for. So Georgina's going to come up, and I promised a question over here from the earlier side. So can I start with you? Wait for a second, and we'll get the microphone. Other people can be thinking of their questions.
I've got two questions. So I'm going to start with the first one. It goes to anyone, really. Can anxiety exist without conscious thoughts, or is it always tied up to an interpreted situation?
Should we start with that one?
Is that for all of us or just me?
Any. Yeah.
Well, should I start and then you guys can jump?
So one way of thinking about how Heidegger views what it is to be human is that he thinks we're self-interpreting animals. So we're always operating in a kind of world where things matter to us, they have a meaning or a significance of some kind, and we understand our own nature partly in response to the significance that we find in the objects and the situations that confront us. So angst would be an example of the kind of response to some aspect of the world and our inhabitation of it that carries a great deal of meaning or significance that's very distinctive. And of course, Heidegger himself is giving a very specific kind of meaning to the notion. And I think one of the interests, for me at least, of these kinds of encounter with psychologists and people looking at neuroscience and physiology is how far what a philosopher might mean by these terms overlaps with and contrasts with the way they get used in other disciplines. But on the philosophical side, I'd say it's always a matter of interpretation. That doesn't mean you have to have lots of conscious ideas going on in your head, but it does mean that the kinds of behavioral response that you make to the world will implicitly involve understanding it as having a certain kind of significance.
And the second one, could anxiety be seen as a form of self-awareness in Heidegger's philosophy?
Yeah, I think so. I think that's kind of what I was trying to get at when I said at the end that he sees it as being sort of ethically and existentially valuable, because there's a sense in which if you get yourself into that particular state of mind, that particular mood, that way of attuning yourself to the world, something really fundamental about your particular nature becomes clear in a way that it wouldn't otherwise be clear. That doesn't mean it can't have all kinds of deleterious effects on you. You know, it might just lead you to be paralyzed by your sense of responsibility for what you're going to do with your life and how you're going to lead it. But that, on Heidegger's view, would be what you might call the sort of maladaptive response to angst. What he hopes it'll do for you is open up the possibility of leading a genuinely authentic life in which you really take ownership of your existence and the choices that you make.
Okay, I think we have a question from Hamburg now.
Yeah, okay. So do people affected by bilateral loss of the amygdala experience maladaptive anxiety?
This is a very good question. And the answer is those people are not that easy to find. There's a few case studies. And it's, again, basically the short answer is it's really complicated, but it isn't that if you have bilateral amygdala lesions and you're alive, which that's the hard part, you will not be anxious. No, that's not the case. But yeah, it's really, there's just not that, there's just few, there's something called, the name now escapes me, but there's a few sort of very specific diseases and stuff that can cause excessive alcohol consumption over many years can cause some specific lesions and things like that. But the problem is that they come with other issues. So it's not like you can take someone who's totally fine and healthy, bilaterally lesion their amygdala and you know, so those people don't exist. So it's all kind of complicated, but the short answer is no, you don't get rid of anxiety by lesioning the amygdala, essentially.
We've got some questions. Can we go to back here, gentlemen? Let's start there. You have plenty of time.
Does Heidegger offer any suggestions as to what taking responsibility and being authentic looks like in practice?
Well, there's a huge kind of controversy amongst the commentators on Heidegger in this bit of philosophy about that. I have a view, so I'll just tell you what my view is. I think his idea of authenticity is in a very significant way content neutral. So for him, you can't tell whether or not someone is leading an authentic life by looking at what particular choices they make. what particular life they decide they're going to pursue, what particular responses they might make to a particular situation. What matters is how they relate to those situations. Do they, as it were, look for ways of sloughing off the responsibility for the choices that they make? Or do they actually fully take on board the ineliminable responsibility that they have for those choices? So he doesn't care so much about what you end up doing, but he does care about something that he calls inauthenticity, which he also calls in German das Man. And that term in German is just the kind of neuter pronoun. So instead of saying I or he or you or me, you say something like one. This is what one does. Right? This is how it is done. That's what the notion of das Man is trying to bring out. And it's really kind of salutary to ask yourself, with respect to the kinds of ways you spend your time, if someone asked you, why are you doing that? Why have you decided to spend a certain amount of time doing this, reading a particular book, going to see a particular movie, coming to a particular seminar, right? Deciding that you're going to be a student in a sixth form college or a university? Why are you doing that? Suppose your immediate, honest response would be, but that's just what everybody does. That's just what is done. That's just what one does. Well, then what you're doing is exhibiting inauthenticity, because you're expressing a kind of bewilderment at the very idea that someone might ask you what your reason is for doing this. You're relating to your own actions and your own choices as if there was no other alternative but to do the thing that you're currently doing. And Heidegger thinks that most of us, most of the time, live exactly that kind of life, that we kind of haunt our own existence. We find ourselves doing things just because everybody else is doing them, because that's what's done. That's what students do. That's what people do when the big new Hollywood blockbuster comes out. That's what people do when the new Booker prize-winning novel comes out. We pick it up and read it. Why? Well, that's just what's done. That's what indicates inauthenticity. And that's why I was talking about the question of whether or not you take ownership of your life. Right? You might end up still deciding to read that Booker prize-winning novel or to go and see that Hollywood blockbusting movie, but then at least you've got an answer to the question, why are you doing it? Because you see something valuable in it. You see something more significant in it than some other existential choice that you might make. So he's not trying to tell you how to choose. What he's trying to get you to do is to recognize that you have an ineliminable responsibility for choosing.
Okay. I was, in this context, if I may intrude, thinking of, is this, to what degree is this valid for everyone? I was thinking of two extremes. At one extreme, you may have people who really have very little control of their lives, perhaps people who are trapped in a war zone or who are starving because they literally have no money or resources, and they may feel totally appropriate fear, but do they feel angst in quite this sense if they have absolutely no control over their lives, which would be very painful, and are in a very painful situation. At the other extreme, you may get people who've chosen lives where they have a great deal of responsibility for other people. I'm thinking in particular of people who work in the health service, for example, and and certainly doctors and nurses report sometimes feelings of severe burnout through having these constant decisions to make which could have everyday major consequences to other people's lives. And I was wondering how this situation, that there's Heidegger's philosophy, or whether it does, applies at the one end to people in destitute situations who have no control, and to people who have chosen but may be struggling with extreme amounts of responsibility.
Yeah, I think he'd be perfectly happy to acknowledge both of those cases, but he might describe them slightly differently than the way you presented them. So another major figure in the phenomenology tradition was Jean-Paul Sartre, and he was a French philosopher who was very much a reader of Heidegger and a critic of Heidegger, and he is often said to have a notion of freedom that's absolute or unconditioned, and to deny the idea of absolutely losing your freedom. And I think both Heidegger and Sartre would say that even if you find yourself in a prison, chained to the wall, there's a sense in which there's always a question about how you relate to that minimal area of choice. So I think both of them would say it's never possible for a human being's responsibility to reach zero level. We can certainly very helpfully contrast situations that are highly constrained from situations that are much less constrained. But the level at which Heidegger is trying to bring out our responsibility kind of goes deeper than that. And part of what he wants to say is you can never entirely lose that sense of responsibility. And I'd say also just briefly about the NHS case. In that situation, the area of responsibility might be in a way maximized or intensified, but it's never an exercise of freedom that's unconditioned. Right? It always occurs within a situation that you can't fully redefine if you want to, and that's partly what creates the burnout, I think.
Thanks.
Okay, we have some questions over here. Can we start the microphone in that corner and maybe pass it down? We've got plenty of time. We can get all three questions in over there.
Hi, I was wondering if you could characterize angst a little bit more. We talked a bit about how it's different from fear, and in one way it seems quite different from fear is that it underpins all worldly decisions, so, you know, ones that you're happy or confident about. But in those situations, I think it's fair to say that a lot of people don't feel it. So I was wondering how Heidegger kind of explains that, if it's something to be developed or something that people have present but don't feel, or what sort of it presents as if it's not an emotion like fear is.
Yeah, so I think what I wanted to say in the talk was that if you're going to talk about angst as having an object, and there is a sense in which you can say that, right? The object is always present. So there's always a possibility of finding yourself responding to that aspect of the situation. And in that sense, it's a necessary possibility. It's always something that can crop up. But it's not that Heidegger is kind of advocating a life in which you are, as it were, from moment to moment, undergoing the kind of experience that a finalist in the University of Oxford undergoes in the 6 weeks or so of their final exams. It's more that what he wants you to do is to take on a sort of binocular relationship to your life. So on the one hand, if you're going to take responsibility for your life, then you have to focus on the particular situations and objects you find yourself confronting. And you have to deal with them as honestly and appropriately as you can. But at the same time, you have to recognize that you're not, as it were, reducible to that particular configuration of objects and situations and responses. There's always something more to you that escapes that particular definition or identification. And it's that that's going to produce what he thinks of as angst, right? That an awareness that nothing outside you ultimately dictates whether or not you stay in that situation, whether you stay with the responses you have to that situation, or whether you modify them, or whether you try to do something to change the situation you're in. So what produces the instability, let's say, the sense of looking out from the particular challenges that you face, that's what he's trying to get. And it doesn't mean that it's going to have a particular sort of conscious flavor. It might not come with particular images or thoughts of any kind. It's more that you're holding yourself to a kind of standard. And it may be kind of utopian to imagine someone, the whole of whose life manage to pull off that trick. But it doesn't involve you being in a sort of gloom-laden emotional state. You know, that might very well be justified by particular situations you're in. But in a way, Heidegger thinks in his gloomy Germanic manner that it's kind of exhilarating if you really get it properly into focus. You know, some people might feel if there isn't an external grounding or justification for the life that I lead, then how can it mean anything? But other people are capable of thinking, that's what gives my life meaning. The fact that ultimately I can take ownership of it and shape it so that it more closely resembles the life I really want to lead. And that's what he is trying to offer you as a kind of positive vision.
So insofar as we think of it as adaptive or maladaptive, would you say that he would think of it as adaptive, fundamentally adaptive?
I think if I had to choose which of those two words to use, then definitely I'm trying to bring out something adaptive. And of course, quite naturally, a lot of the gravity of the conversation and the discussion so far has been worrying about the maladaptive forms of anxiety. But this is where the question of translating terms becomes a really pressing one, because it seems to me that, for example, just to pick up Oliver's instance of the wolf as opposed to the dark forest, yeah, he was using that in order to define his terms, which of course is perfectly fine. Those are the terms he works best with. But from a Heideggerian point of view, what Oliver was presenting as a contrast between fear and anxiety would be a contrast between, as it were, clearly structured fear and not quite resolved fear. Right? So, you know, to me, if you get into a dark forest, you might not know exactly what will leap out at you. But in Heidegger's sense of the term, there is a definite object of your anxiety. And that's what brings it closer to the fear case in Heidegger's sense of that term. So it seems to me that you can look at fear and you can pick out very different kinds of fear. One kind is when it's really clear to you what you're afraid of and what of value is at stake. In another kind, you might say, well, what exactly you're afraid of is not very clear, but it could become very clear. And also, there's a finite range of appropriate strategies for responding to it. You know, even if you're in a dark forest, there are strategies. Bring a torch, right? Try and make sure you don't go in that particularly dense, dark clump of trees, and so on and so forth. And there, Heidegger would say all of that is falling on the side of object-directed emotional responses to the world. Angst kind of goes beyond that, transcends or exceeds that kind of focus.
Can I bring a clinical comment here? Just, I guess this is the idea of bringing the dialogue together. Well, what you mean making me think is sort of the different sort of official disorders that we have within the anxiety spectrum. So you have things like social anxiety disorder or spider phobia, where the object is really clear, like spider or a person, right? And actually for those sorts of disorders, treatments have been particularly powerful in the last sort of 20 years because it's so easy to kind of to pick what the fear object is and then how do you then learn to overcome it.
Yeah.
What's been particularly hard is to treat generalized anxiety disorder, which is another category. I think that's what kind of the symptoms that Oliver put at the very beginning. And one of the challenges about that is because there isn't a clear object, and as a result, people have, in the clinical space, come up with all sorts of theories of like, what is the object in generalized anxiety? And I think your idea around kind of just life and existence sort of really resonated. And one of the theories, and I don't think that one has necessarily produced more effective treatments than the others, but this idea that the fear object is uncertainty, just like the nature of life and ambiguity. And actually, what people with generalized anxiety disorder are scared of is this idea that there's this endless possibility of how things can go. And so then what you end up doing in treatment, if you follow that theory, is that you teach people that they can cope with uncertainty. So, I don't know, I think there are things like randomly go to the movie theater and whatever the film is next, you watch it. You know, sometimes sort of that's part of kind of experiment with uncertainty and how do you learn to kind of adjust. So that was an interesting, object and or not object.
That is really interesting, and maybe there's a distinction to be drawn between uncertainty and a kind of indeterminacy, or even a self-determining aspect to things. So it's not so much, well, so you might think that the forest case is sort of indeterminate, in that, you know, you're anxious, but you're not quite sure what's going to leap out of the darkness at you. There's something indeterminate about the focus of the fear, although you could equally say, well, it's the fear of a dark forest. You know, that's pretty determinate. It's different from fearing a wolf. It's different from fearing your finals exam. So you could jump either way there. But I think when, as it were, the object, if that's the right word, is life or existence, or just the fact that you're thrown into a world where you have to take responsibility for the shape and the content of the life that you lead, I'm more inclined to say that that's not uncertain. It's more that there's a kind of determining that has to be done, moment by moment in your existence, and it's not going to be done ultimately by anybody other than you. You know, you're the one who determines the content and the shape of your existence. And that fact, I can entirely understand intuitively, makes you feel very uncomfortable. You know, it kind of shocks you to the core, but it also, once it's stated, seems somehow undeniable. And struggling with that is what I think Heidegger's trying to get us to focus on. I think it's not that the question between adaptive and maladaptive isn't important, and that it isn't important to distinguish, as you did, between, you know, what you might call normal anxiety problems, and then generalized disorder. These are all really important distinctions to draw for the purposes that we have in your disciplines and in life more generally, where people's lives are seriously debilitated by these phenomena. But for Heidegger, they don't quite get the object of angst, as he understands it, into focus. Because what they bring out, simply by virtue of being able to organize the phenomena into normal and abnormal categories, is the idea that they're intentionally structured, right? Appropriate to or inappropriate to the situations and the objects that you're confronting. And insofar as all of that language presupposes that structured, object-directed intentionality, it falls on the side of what Heidegger would call fear. It's the kind of specific, concrete emotional states that we're familiar with and either know how to handle or know what counts as handling it badly.
Yeah, I'm going to stop you there.
Yeah, sorry.
We've got so many questions, and I think we have one more from Hamburg.
Yeah. Okay, this is a bit of a long one, so bear with me. To what extent does it help to focus on the protective function of anxiety and understanding its cause? What I keep seeing is that pure physical reaction is perceived as bad. The aim seems not to be to not experience the physical symptoms of anxiety any longer. What about accepting the body as a companion and valuing its way of communicating and protecting us, other than trying to look at everything from a cognitive remodeling perspective?
I've been talking so much, I think it's time for you two to chip in.
So I can dip in now. So, you know, I made a clear distinction between adaptive and maladaptive, right? As if those were two actual categories, right? But where you draw that boundary is almost, it's basically impossible, right? As far as I can tell, I mean, I've been thinking about this a lot. When does it become maladaptive? I mean, really only you can say when it's anxiety, and it's when you decide you need to seek some kind of treatment, right? So that kind of point is going to differ for every single person. Like, I can't tell you what it is for you and what. So from that perspective, for someone, the description you just gave there, that might be an excellent way of them reframing or understanding the situation they find themselves in, such that it does not need to be considered maladaptive. But for someone else, that framing of their existence isn't helpful. And so for those people, they're going to seek treatment some way. But I guess there's the sort of... from my perspective as a scientist, like, you have to come up with frameworks to study things and definitions that are almost certainly actually wrong. Like, from a philosophical standpoint, they don't represent natural kinds. Like, but I can at least say, I can draw a line between, let's say, predictable and unpredictable, and I can see at a biological level, neurobiological level, like, they do elicit different responses. But of course, everything's along a gradient. So as one thing becomes further proximally in time and certainty and controllability, there's layers and layers and layers and layers. And I think at the upper level of these layers is what you're talking about with angst, is that things that are sort of, you know, it's existential, it's not proximal, it's not there, it's not controllable. But to go back to that question there, I think it just depends on the person.
Okay, I think that's a good note to stop on. I know that there are some more questions, but I'm going to encourage you to come up and ask them if you don't have to rush off, okay? And I'm going to call an end to it here. I think it's a really good example of the intersection of the three subjects, and I hope that all of you go away thinking about how many different ways in which we can approach a topic like anxiety, which you might have walked into this room thinking, I know what anxiety is roughly. You might leave thinking, I've got to think about this a bit more. So thank our speakers, and I hope to see you again in the winter term.